Hello everyone, welcome to the Heroes Initiative powered by IPCA. These heroes are instrumental in improving quality of life of the patients. Today we have one such hero who has improved life of tens and thousands of such patients. Doctor, we welcome you to the Heroes Initiative by IPCA. So doctor, now we are on retinal diseases, do's and don'ts. Doctor, my first question for you is, what are the common symptoms of retinal diseases and when should I seek medical attention?
So retinal diseases is a huge gamut of diseases. In fact, that makes volumes and volumes of textbooks to cover the whole gamut of retinal diseases. So let me just briefly touch upon just a couple or two or three of the common retinal diseases, especially the most important and common one, which we call it as ARMD for short, or age-related macular degeneration. This happens to be one of the most common ones. So in ARMD or the age-related macular degeneration, as the name suggests, it is an age-related disease. Here, the symptoms would be obviously blurring of vision, especially the central vision. A person may retain a good amount of clarity as far as the periphery is concerned, but when they try to see the center, there could be a smudge on their vision. We do have conditions which cause a peripheral blurring as well. Fortunately, they are a bit rare. Something like retinitis pigmentosa or diseases like that can cause a peripheral blurring with retaining of the central vision. The question about when to seek medical attention, whenever, apart from the routine test that you undergo every year after 40, I would also recommend that if you feel the slightest doubt about the clarity or identifying things at far or near, please do visit your doctor. Most of the retinal diseases are not dramatic in presentation in terms of redness or pain or uneasiness in the eye. The most common thing they cause is visual blurring.
What kind of lifestyle changes or habits should I adopt to protect my retinal health and prevent diseases?
This is a very generalized question, but again, I would want to touch upon the most common condition, which is ARMD, and then give some suggestions which are specific to that condition. So in ARMD, ultraviolet rays are among the common things which worsen the condition. Though ARMD happens to be an age-related change, and then we cannot modify that, but we can modify the speed by cutting down on the ultraviolet rays of light. We could also give some take antioxidants on a routine basis, and antioxidants are known to slow down the speed of such conditions. Apart from that, it's important that we depend upon an eye checkup by an ophthalmologist to detect whether we do have a problem, and there are unfortunately to a huge number of retinal diseases. Lifestyle changes have hardly any role.
Are there any specific activities or environmental factors that I should avoid to reduce the risk of retinal diseases?
So the patients who are prone for a retinal condition called as a retinal detachment, they need to be careful about avoiding activities where we hold our breath tight in the chest. It's called as Valsalva maneuver. So when we hold our breath tight like this, which we do in quite a lot of activities, especially like doing a power lift or a bench press. We also do it when climbing up the stairs or a mountain. We also do it when we do have difficulty in passing the stools, like in constipation, or quite a lot of other activities. If we do these activities on a very, very regular basis and very intensely, patients who are prone to develop a condition called as retinal detachment may be at elevated risk for that. But however, there are no other modifications you can do to help yourself change any activities, or any change in activities would help your retinal diseases. So to reduce the risk of retinal diseases, unfortunately, a lot of these retinal diseases are genetically mediated. So mitigating the risk is not a very possible solution, but instead, I would still insist that you should have a regular checkup so that these things are detected early by the ophthalmologist so that they could take up the treatment proactively.
So, Doctor, your expertise and insights on retinal diseases, do's and don'ts are invaluable to this initiative. And we believe your participation will greatly benefit the patients.